So today we are going to talk about the glycated hemoglobin, that is also called as a HbA1c. So we'll talk in this topic, in this subtopic, terminology, definition, principle, methods, structure, and simple preparation, advantage, disadvantage, normal values, and significance. So as you all know that HbA1 means that is nothing but the glycated variants resulting from attaching of various carbohydrates to N-terminal value of hemoglobin. That protein moiety is going to attach on the N-terminal. That carbohydrate, extra carbohydrate. So what do you mean by glycosylation? Glycation and glycosylation both are different. Glycosylation means that is nothing but the enzymatic addition, enzymatic process for the addition of any sugar, commonly glucose, to a protein moiety. So that is called glycosylation. Glycation means when once glucose attached, it is not going to remove from the hemoglobin. Therefore, it remains inside the red blood cells. So the lifespan of RBC about 120 days. That process, that is the non-enzymatic process. So non-enzymatic process of addition of glucose moiety into the red blood cells. So that is called glycation. So once it has, they are not going to remove. So you all know about all these. So glycated hemoglobin is a form of hemoglobin that is measured primarily to identify the 3-month average, 3 to 4-month average plasma glucose concentration. So nowadays we can also called as a screening test of diabetes. HbA1c is also called as a screening test. So this will give you the mean blood glucose value of 3 months, 3 to 4 months blood glucose value. So we are getting average blood glucose value. So we can see here, this is the normal hemoglobin and this is the glycated non-enzymatic processes where the glucose is going to attach on the hemoglobin residue. So glucose permanently binds to protein like a hemoglobin after prolonged exposure to elevated blood sugar. So that is nothing but the HbA1c. Just see the structure of hemoglobin. You all know about the structure. There is alpha chain and beta chain. So what is the principle behind this? So how the molecule is going to attach? So glycation of protein is a frequent occurrence. But in the case of hemoglobin, non-enzymatic reactions occur between the glucose and N-terminal of beta chain of hemoglobin. So there is nothing enzyme. So that process is non-enzymatic processes. So this forms shift base, which is itself converted to 1-deoxyfructose. So that is finally going to convert into the 1-deoxyfructose. A C base, a nitrogen analog of an aldehyde or ketone in which there is a keto group, is replaced by amine group. As you all know that in carbohydrate, whether there is an aldehyde or keto group, as you all know the definition of carbohydrate, polyhydroxyaldehyde or ketone, group of compounds which produce them on hydrolysis. So we'll get there is a whether aldehyde or keto group. So that keto, just keep in your mind, right? That keto group is going to replace by the amine group. It is usually formed by condensation processes of an aldehyde or ketone with a primary amine. So that mechanism is going to happen there. HbA1c is weighted average of blood glucose levels during the life of the red blood cells, about 120 days. Therefore, glucose level on days nearer to the test contribute subsequently more to the level of HbA1c than the level in days further from the test. So this is also supported by the data from practice showing the HbA1c levels improved significantly by 20 days from the start of the intensification of glucose lowering treatment. Just here, too much good point is the last one. So if we are going to maintain the HbA1c level, if you are going to improvise your HbA1c level at least a percent, it will take a 20 days. Then only your glucose is going to decrease. Your percentage of glucose is going to decrease. So it will take 20 days. Just see the structure. This is the primary amine and this is the carbohydrate. There is a keto group. So that keto group is going to replace by the amine group that is called SIF base. So this process is called as a SIF base. So this is the permanent process, non-enzymatic processes. So what does the HbA1c test measure? So it is going to measure blood sugar in the bloodstream. Once the sugar is attached to the hemoglobin, it stays there for the life of the red blood cells, which is about 120 days, almost 3 to 4 months. The higher the level of blood sugar, the more sugar attaches to the hemoglobin. Just see here. So our first line, our first intention, how to decrease the blood sugar in the blood. If the blood sugar is more, so there is a more sugar attached on the hemoglobin. The percentage is higher. So high the percentage of hemoglobin, which is glycosylated. This is why the result are given as a percentage. So we are giving result in the percent. When blood glucose level are high, glucose molecules attach to the hemoglobin in red blood cells. The longer hyperglycemia occurs in blood, more glucose binds to the hemoglobin in the red blood cells, and the higher the glycated hemoglobin. So if the glucose is impaired, if the glucose is more in blood, so we have to manage that blood glucose through dietary modifications, through physical activity. So it will take a 20 days to decrease your HbA1c percent. So if you are maintaining these in continuously, definitely your HbA1c will comes into the normal. So once hemoglobin molecule is glycated, it remains that way, a build of glycated hemoglobin within the red cells. Therefore, reflects the average level of glucose to which the cells has been exposed during its life cycle. So measuring glycated hemoglobin assess the effectiveness of therapy by monitoring long-term serum glucose regulation. So this will give you a clear-cut picture. That's what we can call it as a screening test, whether a screening is good or bad, whether the progress is good or bad. For the sake of that, we are going to measure HbA1c. So according to that, we can maintain our healthy lifestyle through dietary modifications, through physical activity. So these days, we have to recommended HbA1c at least once in a 6 months. They have to do. And these are the alternative names of the HbA1c. Previously can called as a glycohemoglobin, glycosylated hemoglobin, HbA1c, glycohemoglobin, A1c, beta and hemoglobin. So all these are alternative names. And these are the different forms: fetal hemoglobin, adult hemoglobin, sickle cell hemoglobin, hemoglobinopathies, glucose in the blood reacts to the hemoglobin, that is glycated hemoglobin. So these are the different forms of hemoglobins. Why is this test performed? What is purpose? Why we are going to prefer this test? So HbA1c test is a way to assess blood glucose control over time, whether the person having control glucose or not.